Subscribe medical knowledge. Observe the above photograph of an instrument and answer the questions. 1. Name the given instrument and its use. 2. Outline the steps of procedure. This is posterior rhinoscopy mirror. As the name suggests, rhino means nose and posterior means back, so it is used to see posterior of nose. Patient sit in front of the doctor and is asked to open the mouth. With the help of a tongue depressor held in the left hand, tongue of patient is depressed and is asked to breathe from the nose. The posterior rhinoscopy mirror is held in the right hand and is warmed to prevent misting before use and checked on the left palm before use. The mirror is then introduced into the mouth facing upward and sliding over tongue depressor and passed behind the uvula. Different parts are examined by rotating the mirror. Observe the above photograph of an instrument and answer the questions. Name given instrument and its use. It is Killian's nasal speculum and is used in anterior rhinoscopy. It is used in the following operations: septoplasty, intranasal polypectomy, removal of foreign body or rhinolith, SMD of inferior turbinate, cauterization in epistaxis. Observe the above photograph of an instrument and answer the questions. Name given instrument and its use. Why this instrument is angulated. It is Tilly's dressing forceps. Used in anterior nasal packing, any nasal surgery, and removal of cartilage and bone or gauze pieces from the nasal cavity. The instrument is angulated so that vision of surgeon is not obstructed during surgery. Observe the above photograph of an instrument and answer the questions. Name given instrument and its use. Another instrument similar to it. It is Luke's forceps. Used to remove cartilage and bone pieces during septoplasty or SMR. To remove polyp during intranasal polypectomy or Cadwell-Luke's operation. To take a punch biopsy from growth in the nose or oral cavity. Its shape is similar to tonsils holding forceps. Observe the above photograph of an instrument and answer the questions. Name given instrument and its use. Name operation in which this instrument is used. It is free as dissector. Used to elevate mucoperichondrium or periosteum from underlying cartilage or bone. Used to manipulate turbinates during FES. Used to prepare and thin out temporalis fascia. Observe the above photograph of an instrument and answer the questions. Name given instrument and its use. Lichwitz trocar and cannula. Used for antral washout and proof puncture. And read the procedure kindly. Observe the above photograph of an instrument and answer the questions. Name given instrument and its use. In which step of operation this instrument is used. Why its V-shape. Name complications associated with this instrument. Tilley's nasal gouge. Used in SMR and septoplasty. Used in step in which bony spur or maxillary crust is removed from floor of the nasal cavity. Its sense is V-shape because it gives better encourage. Complications. Excessive bleeding. Palatal damage and perforation. Observe the above photograph of an instrument and answer the questions. Name given instrument and its use. Outline the difference of shape and method of using. Ashe's forceps. Walsham forceps. Ashe's forceps is used to straighten the nasal septum after fracture. Walsham forceps is used to realign the nasal bone fracture. Read the remaining. Observe the above photograph of an instrument and answer the questions. Name given instrument and its use. What are advantages of instrument? Jansen-Middleton septal forceps. Used in SMR. Septoplasty. Rhinoplasty. Advantages. High mechanical advantage. Thick bony spur and bone can be nibbled with ease. Observe the above photograph of an instrument and answer the questions. Name given instrument and its use. Name operation in which this instrument is used. It is suction nozzle. Used in septoplasty. Rhinoplasty. Cadwell-Lukes operation. FES. Polypectomy. Turbinectomy. Mastoidectomy. Tympanoplasty. Suction cleaning. Observe the above photograph of an instrument and answer the questions. Name given instrument and its use. What are the different types of such operation? What are the other surgical options available? Hayman turbinectomy scissors. Used in turbinectomy. Types are partial and complete turbinectomy. Other options are electric cautery of inferior turbinate, submucosal diathermy, CO2 laser surgery, radiofrequency turbinate reduction, cryosurgery. Observe the above photograph of an instrument and answer the questions. What is its name? What should be the outer diameter for adults and children? The usual length for nasal use. What is the significance of green color coding for this instrument? What are the other color codings? IT is a nasal rigid endoscope. Its diameter for adults is 4 mm and for children is 2.7 mm. Its length is 18 cm. Green color coding suggests that it is 0-degree telescope. Other color coding are red 30-degree, black 45, yellow 70-degree. Observe the above photograph of an instrument and answer the questions. Single
Name
most
given
common
instrument and its
complication
use.
associated with it. Ostrum nasal. Punch forceps. Used in FES. Uses in operation. Widening of maxillary sinus ostium. Uncinectomy. Complication. Damage to the nasolacrimal duct. Observe the above photograph of an instrument and answer the questions. Name instrument. How does this work? Name surgical operations in which it is used. Hard piece of microdebrider with straight and curved blades. There is a blade in it which rotates and cut. Used in septoplasty polypectomy. SMR. Rhinoplasty.